All right. Good afternoon, everyone, and welcome to our May 23rd, 2023 State Advisory Council meeting, which serves as our Vermont Early Childhood Action Plan Summit, where we are focusing on ensuring that we keep our strategic plan, the VECAP, at the heart of all of our work. I'm Dr. Morgan Crossman. I'm the Executive Director of Building Bright Futures, which is Vermont's Early Childhood State Advisory Council. And we are really excited to bring everyone together to talk about the progress we've made in our strategic plan and to evaluate our strategy for the coming year to reach the goals that we've collectively outlined. I want to start by saying thank you for every one of your commitment to strengthening our early childhood system and improving the well-being of Vermont's children and families prenatal to age 8. The VECAP is such a critical document for Vermont's early childhood system because we are setting the vision and strategic plan across every single sector for kids and families. And it's designed to build collective accountability and to work towards measurable, achievable goals by 2026. It's also a document that is supposed to be a living thing. It's designed to evolve based on new data and evidence, new best practices, lessons learned across our system, and based on what we've seen through the identification and measurement of child and family and system outcomes and indicators. Our goal in this strategic plan is that every Vermonter is able to see themselves and their work reflected and represented within this strategic plan. And the VECAP articulates the following goal for our system, which is that Vermont aspires to realize the promise of each and every Vermont child by ensuring that the system is integrated, continuous, comprehensive, high quality system of services that's equitable, accessible, and will improve outcomes for each and every child in the prenatal period through age 8 and their families. So we're going to dedicate the first part of today's meeting to celebrating the work and the progress and use it to monitor our strategic plan. And then the second part of our meeting today is going to be for the State Advisory Council as a business meeting, and that'll be from 2:30 to 3 o'clock. So we will review and vote on the FY24 Building Bright Futures budget. We'll do a roll call at that point, and everybody who's on the call now is welcome to stay on to listen to that overview and the discussion. So I want to invite you to share your name and affiliations in the chat bar as we move forward. And I'd like to hand it over to Beth to talk us through the next piece.
Thanks, Morgan. My name is Beth Trzanski. I'm the Deputy Director at Building Bright Futures. The goal of today's meeting is to recommit to the Vermont Early Childhood Action Plan, our strategic plan. We have a practice with the State Advisory Council to start our meetings with a mindful moment. And so as we take, I'm going to invite you to take a moment of silence. I will not walk you through any breathing today, but for you to take that moment to reflect on your goal, on your role in the early childhood system, and to consider, how am I an agent of change to achieve this vision outlined in the Vermont Early Childhood Action Plan? How am I an agent of change to achieve the goals we set out for ourselves? I'll give you a moment to consider. So thank you for joining us today, and thanks for making those intros in the chat bar. We are thrilled to have you with us today. Many friends across the BBF Network registered for this meeting today. We have 57 on so far and more joining. Based on registration, we have about 35% participation in one or more of our regional councils. So welcome, regional council partners. We have about 24% of those joining today participate in one of the 7 Vermont Early Childhood Action Plan committees. welcome. 22% serve on the State Advisory Council, and many of those members also attend either regional councils or VECAP committees. And then about 19% are other public and private early childhood stakeholders across the system. So thanks for taking a moment to introduce yourself in the chat bar. For the SAC members in particular, if you can change your name, if you know how to, change your name in Zoom. So essentially on the top right corner of your video, there's 3 dots and it gives you an opportunity to rename. If you can just put your name and then /SAC so that as we move into small groups and then come back for discussion, folks can recognize you as an SAC member. That would help us out. And also different from other SAC meetings is that we'd love to see everyone's face. So all are welcome to keep your videos on. We will spend most of our time in small groups. And then as Morgan said, we'll come back for discussion, starting with the SAC and then opening it up to others. And then at the very end of our time, we will transition to a business meeting. So that's some business. I do want to take a moment to share my appreciation to the public and private co-chairs of our VECAP committees who play an important role in holding the short and long-term vision that is needed to monitor these issues and engage their committees in this work. So we have several folks who go above and beyond every month. And so for your time and leadership, thank you.
All right. So as we come back together and really think about how we are monitoring our goals and strategy, I just want to remind folks that, this strategic plan, the Vermont Early Childhood Action Plan, is about shared accountability. It's about collaboratively defining, but then celebrating successes and the priorities that we've built around children and families in Vermont prenatal to age 8. And part of today is rededicating our commitment to the vision and priorities, and then coming together in small groups to celebrate some successes, strategize how we are going to make progress in the coming year, and any needs for policy change as we're thinking about the next round of policy recommendations that will be endorsed by the State Advisory Council in the next few months. It's really resetting and inspiring each other, recognizing each other's discrete roles and responsibilities in moving the work forward, but also where there's opportunities for partnership and doing that work collaboratively. And again, really committing to holding children and families at the center of all of our decision-making and using data to inform how we operate. The next part of this is really around how we monitor the system. How do we know where there's progress? How do we know where there are still gaps and what should be prioritized for the coming year? So I'm going to ask a member of my team to place the link to the strategic plan in the chat. And as we're thinking about the monitoring section of our work, holding the vision and strategic plan and monitoring is outlined as Building Bright Futures' role in our state and federal statute. And within the VECAP itself, our role at Building Bright Futures in this network is goal 4. It's creating an integrated, well-resourced, data-informed system. It means bringing partners together at every single level of the network to determine where we're seeing integration and alignment, where we aren't, and where there are gaps in resources. It's holding all of the partners in the system accountable and then supporting the state in really saying, here's what data we have to inform decision-making, and here's how we are elevating family and community voice to inform that decision-making as well. So this visual is not new to most of you. It's really outlining this incredibly robust Building Bright Futures network and showing us all of the different ways within this network that we are monitoring the early childhood system. So just to name a couple of those, our 12 regional councils are the folks on the ground who are at all times monitoring the needs, the challenges, the successes of our kids, our families, the communities, our educators and providers across the system. We also have data, both qualitative and quantitative, that tells us the status. It talks about trends and outcomes for kids and families, as well as the service system and the program statewide. We also have our 7 strategic plan committees that are also monitoring and implementing and evaluating our priorities and supporting the state in developing recommendations to move forward. And then we have our State Advisory Council network and the Interagency Coordinating Team, the State Advisory Council, which is our 23 governor appointed membership, and the Interagency Coordinating Team, which is the public partners or our agency leaders that are coming together to integrate and move the body of work forward. So what's not listed here is the VECAP Summit, which is a virtual place where each partner, everyone on the call, everyone within our network, either as an individual or an entity or an organization within our system, has the opportunity to come together and really document where we've seen that progress and where we've worked to create change based on this plan. So how do we define as a system and as a state what progress looks like and the current status of our goals and objectives? And I just want to reflect that this is something that not just Building Bright Futures in this network are working on, but our counterparts across the country are talking about how to do this well. And there are so many different concepts and mechanisms that other states are using to monitor progress and using some of the federal grants to support the development and maintenance and monitoring of strategic plans. And some of the ways that they are doing that is through monitoring policy change, different investments, what partnership looks like, when and how new programs are developed and maintained, the capacity and slots that are created across different sectors, and what seamless navigation looks like for families. So before we transition into small groups, the bullets on the right side of the screen are what I want to draw your attention to. And want you to be thinking about as you're heading into small groups to talk about different areas of content. So again, how are you an agent of change to reach the goals that we've outlined in the strategic plan? And based on where you sit and what your role is, how are you and your teams defining progress or success? These successes may be relationships and how you are cultivating strong partnerships and relationships to collaborate on key efforts to support kids and families. It may be that there's a specific project within your region or within your strategic plan committee that's been initiated to tackle a specific project. It could be that we've seen significant policy change to better meet the needs of kids and families. It could be that there's new data that's being collected or shared or integrated and linked. It could be that there's a new funding source or new funding dedicated from the state or from the feds or from any source, our private philanthropic community, saying we're going to tackle this area of work together. Is there some urgent need that was acknowledged and action taken that we need to document as a team to say we've made progress in this area? So as you're heading into small groups, I want you to think about those questions. And I also wanted to give an example of some of the monitoring tools that we use at BBF to capture what we hear from you all. So what you're seeing on the screen right now is a very abbreviated table of an inventory that we are building and will collectively build to monitor the strategic plan. So again, what you're seeing on the screen are example accomplishments by goal from 2022. So right after last year's VECAP Summit and right before Vermont wrote the preschool development grant, we started to build another inventory to say what were the major accomplishments. And I'm not going to read through all of them, but I just wanted to give you a couple of examples as you head into small groups of the types of things we want to hear from all of you. I think what's important to note about this visual is it is not a robust list in this table. We have a much larger version behind the scenes. We also have been capturing lessons learned and opportunities as well as indicators to think about how we are monitoring and supporting the work. So again, a couple of examples around goal 1, all children have a healthy start. Looking back on 2022, we saw an increase in perinatal physical and mental health access through Vermont's expanded Medicaid coverage. We saw some really incredible work happen in developmental screening across our sectors. As we look at goal 2, families and communities play a leading role in children's well-being. We saw some really amazing work happen during the COVID-19 pandemic where there were cultural liaisons supporting English language learner populations as well as many other populations across our state. We saw some interesting and exciting new offices and opportunities within state government through the Office of Racial Equity, through the AHS Resilience position that was created, and the Office of the Child Advocate that was created. And then as we look at goals 3 and 4, some really incredible work around public investment, around CCFAP, supporting the early childhood education workforce and reducing barriers to professional development. We saw an increase in Medicaid billing rates for mental health services allowed through designated agencies. And as we think about goal 4, some really incredible work in the launch of CDDIS that is continuing. We also developed Vermont's Early Childhood Data and Policy Center as a mechanism to centralize data and publications. And we saw some significant legislative action prioritizing an examination and understanding of governance and financing. So again, as you're thinking about going into small groups, whether you're in the workforce or mental health or family engagement and leadership sections of this, I want you to really be thinking about where from your seat you've seen some significant change in the system that you want to document and call attention to. The last tool that I want to mention to folks before we move into small groups is the Regional Council Priorities Map. And I just want to give a quick shout out to all of our regional council partners. There's such incredible work that's happening in regions to meet the needs, to be convening and strategizing about how to meet the needs within your different areas of the state. And what this map gives us the opportunity to do is identify and elevate needs as teams. So this annual priority setting identifies the top 2 most critical gaps and needs that are impacting children and families, and the greatest opportunities and leverage points for how we should be thinking about tackling these in the coming year. So one quick note is that this may not be the final map. We are just wanting to show everyone the tool as of this morning, as a reminder that when we think about the needs of kids and families across the state of Vermont, there's absolutely some unique regional variation for kids and families, and there's some themes that are starting to come through. And this year, the current status of the map is that 5 of our regions have identified child and family mental health as a top priority. 4 regions articulated that building resilience in children, families, and communities is a top priority. 5 of our regions have prioritized quality and capacity of childcare and early care and education. And 4 regions have prioritized access to basic needs. So again, just a really important reminder that we are all across the state really committing to meeting the needs of kids and families. These top 2 priorities are critical, and there are so many more needs that folks have articulated and are seeing. And our team is doing our best to capture all of that feedback and really think critically about how we as a network are using these regional council priorities to then think very critically about our State Advisory Council network recommendations in the next couple of months and how we integrate those. So lastly, as we're thinking about this map, I just want to say to all of our partners across the network who maybe not traditionally sit at our regional council tables, don't let today be the only opportunity that you're intersecting with our regional council partners. It's such an important moment to get to know all of our regional leaders and the folks on the ground who are working with kids and families. So I invite you to, yes, consistently refer to this map as you're thinking about your own priorities from your seat, whether it's at the state level or strategic plan level. But get to know your regional partners and be talking with them about the challenges and priorities, and really thinking critically about how we are moving this work forward together. It's a really critical time for us to be breaking down those silos. So I think we're ready to transition into small groups. Beth, if you want to walk us through.
Yeah. All right. So we are going to give you an opportunity to choose one of 5 themes that is called out in the VECAP and so we'll spend about 45 minutes or so in these small groups. We have folks set up and ready to facilitate and take notes, so you are able to show up and participate. You can attend any group because you bring your life experience and professional context to the conversation. And I encourage you to reach outside your traditional go-to issues, because having diversity of perspective in these groups is really important to build a full picture of how we are doing working towards these goals. The groups will involve a series of prompts to mark accomplishments and then discuss strategy and needs for policy recommendations or action. And as Morgan shared a few examples earlier, you'll have an opportunity to kind of share from your perspective, what are some of those accomplishments? And then when we come back together, we want to hear both about your discussions. We're not going to do a formal report out from each group, but we do particularly want to hear from SAC members, what key accomplishments and priorities you are most excited to steward in the next year through your own work, and pieces that you were inspired through your conversation. So the slide shows you the 5 groups. Group 1 is access to basic needs. Group 2, high quality and inclusive physical and mental health services. Group 3, high quality and inclusive early care education and after school programs. Group 4, family, partnership and resilience. And Group 5, workforce development. We will open the Zoom rooms and you can choose which group you want to go to. Group 5, the workforce group, will stay in this main group. So if you want to be in that group, don't choose a Zoom room. It just essentially is just stay put. And once everyone disperses, they will move into a discussion in this main Zoom space, if we can call it that. Anna, I'm going to invite you to open those rooms and we will see you all back at 2:05 or so. Thank you. There we go. So why don't we start with SAC members? We will start there and then open the discussion up. We have some time for a discussion, but would love to hear, kind of based on key accomplishments and priorities. What key accomplishments and priorities are you most excited to steward in the next year through your work? What did you hear that excites you, or things that are soundly in your wheelhouse that you feel like you want to help carry forward? Any SAC members want to get us started? What excited you about the conversation? Things you want to carry forward?
I can go first, I don't mind. I think
Carol.
for me, the exciting piece was hearing so many different folks from that group talk about the need for increased collaboration around family and caregiver engagement, and how do we do that effectively so that we see parents as leaders and parents helping to push decision making, and caregivers as well. So that's fine.
That's awesome. Any particular strategies that came out in terms of how to build those relationships and those partnerships to really make sure that that happens?
I don't know if I picked up specific strategies, but I think one, I think a key strategy is talking about it in a group and just all saying we want to make that a priority. And so, I think that sort of was the start of hopefully some nice progress.
Awesome. Thank you. Elisa, and then Jessica and Janet. Thanks.
Well, because Carol just went, I talked a bit about Dulce in our group. We were talking about physical and mental health, and I'm excited to see how we can continue that work with potential expansion of the Dulce model. And I was saying in the group that I felt like it met, many of the strategies and the goals, including the one that Carol just mentioned around family engagement. So that's what I'm excited about in the coming year.
That's awesome. Elisa, can you give us like a tweet, a super short description of how Dulce helps us provide access to mental or physical health for families?
Sure. So although it's not in every pediatric practice, Dulce does makes universal, is universally available in the practices in which they are. And so they're a family specialist who's a essential member of the CIS team and a staff member at the Parent-Child Center is building relationship, conducting screening with all families with, generally speaking, babies, and connecting them to the early childhood system and of services. So it does that sort of integration and connectivity piece of the work.
Awesome. Thank you. Jessica.
Thanks. I was part of the workforce group, but I would say that we talked about all kinds of things and about how it'll be interesting to see how the new child care legislation will impact our workforce, but will also impact overall assuring high quality early childhood care in Vermont. And the really exciting part as far as Building Bright Futures goes and our work together is the ability to look at all of the changes we have made in this legislation, to watch it, to measure it, to talk about it, both qualitative, quantitative, and really be able to help so many other states that are contacting me now to say, hey, come and talk to us about what you're doing there. And my point to them is, let's see what we get for data before we continue to move, that we've got a lot that we're gonna try here, and it's really exciting. And we're lucky enough to have a program like Building Bright Futures to help us to really look at how it's working as we get going. So that's what's super exciting to me as a state.
Thank you. Janet.
Hi, everybody. I just building on what Carol had offered from the family engagement group. I think we talked, there was some specific strategies that were discussed around compensating families for their time when we're asking for family engagement and family leadership. In the Northeast Kingdom, talking about some of the offering things like the tummy time and the family play groups, but then using that time as a time to develop relationship that can then turn into engagement and then turn into leadership. And even some of the, some of it was even just like the very, like specific examples related to how we're getting, removing some administrative hurdles so that people can have time to be able to engage. One thing that sort of I had flagged from some of sort of my learnings over the last couple of months, sort of in this role and beginning to engage with some other states, was sort of thinking about how can we, as how should CDD specifically, should Department of Children and Families as a whole be thinking about our family engagement and our family engagement work, and how can we and in general, we know that there are tons of efforts around family engagement happening across the state, and how instead of like mentally us thinking of that as fragmented or siloed, like how do we actually figure out how we sort of can like weave those things together, so that we are getting, so that it feels more like we're getting a cohesive and a comprehensive look, and an understanding of what families' needs truly are, and that so that we can make sure that we're being as as responsive and forward-thinking as we can be.
Thank you. Flor.
Hi, everybody. I was in the high quality and inclusive early care and after school program, group 3. I'm going to try to sort of summarize a little bit, but we started with a vignette, which was really nice to just get us to, what are we aspiring for? So that brought us to, our desire for the quality, access, and affordability that we've been working on. So they implemented the relationship building, the transition from preschool to kindergarten, having clear mix metrics on an improvement. But one of the main things, and this is with my Vermont school board's hat, is one of the things that we continue to aspire for is like, what are we going to do if we finally have that ABM money for our preschools, and how do we integrate those services and continue to focus on high quality access, high quality delivery systems for all our kids. And last is we really aspire for a statewide system of accountability for the use of public funding to ensure that high quality programming is available for all our kids. And I think that, and please, Dimitri, jump in, the equity of access, we've been working on a lot of our policies. So the equity of access, of course, available to families is hard to measure. And how do we continue to use data to inform those decisions, knowing that our ESSER funds and some of the funding is going to disappear when we're headed to a fiscal cliff. That's it. I probably missed something, Dimitri, so please jump in.
I think just the other comments that came up were partly around the importance of networking and how the State Advisory Council really provides for that forum, and how that's going to continue to be important moving forward as we integrate the components from the child care bill. And to that, speaking for myself, I also made the point that I'd love to see as a measurement outcome something really concrete around how we're not only serving more kids, but how we're improving the quality of their lives through something like ACEs scores or something really tangible that we can say that kids, we're not only getting more kids access to the system, but we're actually seeing their lives improve in really measurable ways.
Thank you. Tag team on the high quality education. I wonder, have we heard from someone who is in the basic needs group yet? I feel like I've heard examples of folks speaking, but I wonder if there's someone who is in that group one who wants to share something that was particularly exciting or inspiring.
Hi, Beth. This is Ruth Hardy. I was in the basic needs group, and you asked for SAC members. So I think there were two of us in there. But one of the things that I think we talked about a whole bunch of stuff, just like all the groups. But one thing that I think was important that we touched on was that just how over the last 5 years, basic needs have been highlighted, and the necessity of basic needs. It seems so silly, but the pandemic made us realize how important food, housing, education, community, and healthcare are. And those are, very basic needs. And it also made the conversation about basic needs in some ways easier, because we no longer have to convince anybody that those things are important. So from that, we talked about a whole bunch of different, both successes and continuing basic needs challenges that we're facing, and some exciting things that are happening on a big scale and a small scale as well.
Thanks, Ruth. Appreciate that. I wonder if there's any other SAC members in particular, and then we can take a few comments from other partners who are joining us today.
I'd be happy to share. I was in the physical and mental health services group too. And for me, I'm most excited around expanding access to high quality mental health services. As working in community mental health, that one feels quite obvious that would be my focus, but it's really exciting. We've had a focus on training all of our early childhood providers in ECFMH, early childhood family mental health, in child parent psychotherapy. And that model, even when they're not utilizing it, really helps to frame their work with all families in understanding the significance of the work with the caregiver and the caregiver's history on what might be happening with the child and the parenting. And we're really excited to continue those efforts. We've actually been able to expand them through support from the Department of Mental Health with some grant funding to have an outpatient provider trained in it as well. So we'll be able to offer that additionally within our clinics outside of our ECFMH providers. And we've also added an early childhood clinical supervisor where we'll have just a real area of specialty outside of myself and my role to really shepherd that work and continue to be able to keep it going and expand it, which should really be able to provide some additional avenues where we can really dig in even further with our clients, but also in the community. And that's really exciting because the work never ends. It just kind of continues and evolves over time. So that's very exciting. We also do track data. I know that was mentioned. And so we utilize the cans 0 to 5 for the really little ones and cans 5 to 22 for others. And we send that data to DMH and we do analyze that as well to look at outcomes. So I just want to share that with people. That's really exciting. We do have the opportunity to look at where we're making a real difference. It looks at not just what's a struggle, but also where the strengths are and where we can support not only the child, but the caregiver in enhancing those strengths. So it's really exciting. Thank you.
Thanks, Heather. That's awesome. And some comments in the chat that there's preschool development grant is supporting some of that work as well, which is awesome. Thanks. Others? Great examples, strategies, and where folks feel like our strategies are missing the point and where we need to lean in a little bit more. So it's great to hear both sides. We do have a few minutes. I wonder if there are other partners on the call who are kind of particularly excited or want to highlight an accomplishment or a priority that you are excited to steward in the next year. All right, well, as you guys give it some thought, I want to thank folks for coming here to get today. A reminder to do the stakeholder survey, and maybe Dora, you can put that link in the chat if you haven't done the BBF stakeholder survey. That's something that we're asking everyone to do this month. It's an annual process. We are going to work to compile the notes from these small groups and create a document that you'll be able to look at as we chart both the accomplishments as well as our priorities for the coming year. That information will help guide strategy both for the VECAP committees and for the BBF network. You know, we came together earlier. We shared the regional council priorities map. Morgan shared that map. And what I'm hearing is some consistency, right, around emerging priorities in both regions and regional partners as well as statewide partners. And I think what I'm most excited about is real interest in and kind of believing that quality partnerships is really what makes change, right? And so being able to develop those partnerships and having that transparency of information exchange is a priority so that the network can function as well as so we can kind of move on some of these priorities in the VECAP. So thank you very much for kind of contributing your ideas and being here today. Any last thoughts before we transition to our business meeting? Okay, so thank you, Dora, for putting the link for the stakeholder survey. I'm going to give you a moment to do that if you haven't done it already. We're going to pause for a few minutes and transition to a business meeting. SAC members, please don't go anywhere. But if you need to take a body break, you can. All others, you are welcome to stay on for a business meeting. The primary order of business is the FY24 budget for BBF, but you do not need to stay. So that's for partners. But SAC members, we will be back in a minute